Hello, my name is Shanmas Chua Baldivia and I am a nursing student from NUNESCOST and I am going to perform the nebulization therapy. Definition: a nebulizer is attached to a flow of air. Oxygen converts a solution of a drug into an aerosol for therapeutic inhalation. Assessment: evaluate patient's need for nebulization, evaluate ABG, sputum cultures, and chest x-rays, review the physician's nebulization order for length of treatment and medications to be used, assess patient's lung sounds before and after each treatment. Equipment: prescribed air supply piped in cylinders or via portable air compressor, adapter, nebulizer apparatus, mouthpiece or appropriate oxygen mask, Hudson mask, prescribed medication, sputum cup. Okay, we have also our special considerations. The special considerations are the medication as well as its administration by air. Oxygen is prescribed by a medical practitioner. It may need to be diluted with 2 to 3 ml of normal saline, is normally prescribed 3 to 4 times a day. The procedure may be coordinated with the chest physiotherapy and may be administered by a nurse or physiotherapist. For a patient with asthma, an estimation of peak flow of tidal volume may be recorded before and after nebulization therapy. There are also types of nebulizer. Number 1 is the jet aerosol nebulizer, uses gas under pressure. Number 2 is the ultrasonic nebulizer, uses high frequency vibrations to break up the water and medication into fine drops or particles. And number 3 is a high flow nebulizer. Thank you. Procedure: gather all the necessary equipments, check medication order against the original physician's order according to agency policy, clarify any inconsistencies, check the patient's chart for allergies. This comparison helps to identify errors that may have occurred when orders were transcribed. The physician's order is legal record of medication orders for each agency. Know the actions, special nursing considerations, and safe dose ranges, purpose of administration, and adverse effects of the medication to be administered. This knowledge aids the nurse in evaluating the therapeutic effect of the medication in relation to the patient's disorder, and can also be used to educate the patient about the medication. Place the medication on a tray or move the medication cart outside of the patient's room, or prepare for administration in the medication area. Organization facilitates error-free administration and saves time. Transport medications to the patient's bedside carefully and keep the medications in sight at all times. Careful handling and close observation prevent accidental or deliberate disarrangement of medications. Identify the patient by checking the name and identification on the patient's identification band, or ask the patient to state his or her name. Explain the procedure to the patient to gain cooperation and to allay anxiety. Fill the nebulizer cup with the ordered amount of medication. This ensures that the required medication amount is given. Turn on the air compressor. Observe the fine spray from the nebulizer to check that the equipment is working. Encourage the patient to breathe the nebulized vapor through the mouthpiece. Breathing through the mouth or normally with a mask helps the medication travel to the lungs for maximum effect. Remain with the patient until all the solution has been nebulized. Instruct the client to continue the treatment until he or she can no longer see a mist on exhalation. Lack of mist ensures that the client has inhaled the entire dose. Encourage the patient to expectorate, as the medication may help to loosen the bronchial secretions. Ensure that the patient is left feeling as comfortable as possible. Bronchospasms is further reduced if the patient is relaxed and reassured. Wash and dry the nebulizer tubing and mask or mouthpiece with warm soapy water. Proper cleaning decreases the possibility of pathogens entering the client's respiratory tract. Retain the equipment in a polythene bag for the patient's next administration to prevent infection. The equipment should be changed every 24 hours. Document the nursing practice appropriately, monitor adverse effects, and report any abnormal findings immediately. To ensure safe practice and enable prompt, appropriate medical and nursing intervention to be initiated. Evaluation. Increased expectoration of secretions occurred. Patient experienced less labored breathing. Lung sounds improved. Aerosol medication administered into deep air passages and ventilation improved.